There's another couple questions here that I'm looking at on the topic of vaccines. So maybe I'll aim this towards Lisa again. So these are from Beverly and Anna, two related questions. One is, are other vaccines protective against COVID-19, such as those used for pneumonia or flu strains? We always advocate vaccines for our IBD patients. Do those help at all? And as a follow-up, if a vaccine for COVID is developed, will patients taking immunosuppressants be able to receive the vaccine?
Great questions. So in terms of the vaccines that you take, particularly an anti-pneumococcal or pneumonia vaccine or a flu vaccine, do they directly change what happens if you get COVID-19 or protect you from getting it? The answer is not. Biologically or immunologically speaking, they don't, but they will keep you from getting co-infections with influenza and COVID-19 or influenza and hopefully pneumococcal disease. And I can tell you, at least from the outcomes that we've seen so far, co-infections with those two things, either pneumococcal, a bacteria, and COVID-19, or influenza and COVID-19 together, that does not go well. So your vaccines are protecting you from getting very bad disease, particularly if you get COVID-19 with one of those other things. So are they worth getting? Absolutely. Are they going to directly protect you? No, but if you do get them, it will keep you from having very bad disease in the case of a co-infection. New vaccines are being developed. There's been some race to the phase 1 that's almost unprecedented, in fact, in terms of the turnaround. And there are several vaccines that are under development for first-in-human studies at the moment. There's at least 3 that are being trialed in Canada at the moment. A couple of them, one of them is a DNA technology. One of them, or an RNA, nucleic acid kind of technology. One of them is an adenovirus, a modified adenovirus that is a live vaccine. And there's another one with a different platform that's being developed as well. And there are others that are screaming up to the phase 1 sort of testing line. The key thing to answer your question is whether or not the vaccine is a live vaccine or not. And if it is a live vaccine, once it becomes available, there may well be some stipulations around whether or not it can be administered when someone is on certain types of biologics. If it's not a live vaccine, chances are that it will be something you can take, but there are also new classes out there like these mRNA and DNA vaccines that we're not quite sure where they sit yet, but may be okay. So, and there is some trials of giving people old vaccines like BCG, and we don't know if those are going to be useful at this point either. But that's a great question, and hopefully we will have some choices in vaccines that will allow both live and non-live options for people on immunosuppressants in about a year.